Okay, the live stream has started. Sorry, everyone, for that. I am so excited to host this session with Dr. Babrowski. She is a vascular surgeon and an associate professor of surgery at the University of Chicago. She completed both her general and vascular surgery fellowship at the University of Chicago. She is an expert in both open and endovascular technique, and her practice focuses on providing tailored patient care. Dr. Bobrowski also specializes in the treatment and management of complex peripheral and aortic conditions. I'm sorry. And she serves as the director of the Limb Salvage Center at the University of Chicago as well. In addition to her clinical work, she also has an interest in education, serving as the Vascular Surgery Fellowship Program Director. An active researcher, her area of focus is on outcome research in underserved vascular surgery patient populations. She holds leadership roles in multiple regional and national societies, and in fact, she is a governor for the American College of Surgeons. I am always yearning to learn more about her, and I cannot wait to hear more about her journey. And for all the questions you guys have, we'll have a Q&A session after her presentation, so feel free to put those in the chat and in the Q&A box. So everyone, please welcome Dr. Babrowski.
Well, thanks very much, Sam, for that introduction. Basically, I don't need to say anything more because you said everything there is to say about that. But I think maybe we can find a few things to chat about here. I'm going to share my screen because I do have a bit of a formal kind of talk to give, but I'm going to make sure that I save lots of times at the end for questions because vascular surgery is something that most people are not super familiar with. So I'm sure that this will hopefully it'll generate a lot of discussion. So as Sam mentioned, I am a vascular surgery and I am at the University of Chicago, but what do I really know about any of this, right? Everybody's journey is unique and everybody's journey comes from a different place. And I think the most important thing and theme that I want to share with everybody today is that it doesn't really matter where you're coming from or where you end up, but the most important thing is that you really enjoy the time that it takes to get to where you are because it's a very, very long time. So I graduated from Illinois Wesleyan in 1998 with a BA in biology, and I minored in French. And the reason why is because I went to a strong liberal arts program and I wanted to make sure that I really took advantage of that because you can be a biologist and just focus on science. But I feel like it's understanding people and having the ability to learn how to communicate with people that is really a huge part of my job. I don't use physics in my job. I don't use organic chemistry in my job. All the things that you learn as a pre-medical student, you in general don't really know or don't really use on a day-to-day basis, but it is the ability to be a fully actualized human that's going to make you be able to connect with your patients and be a person who really enjoys what it is that they're doing. So regardless of what it is, just be yourself. I graduated from college and there was no way that I was ready to go into medical school. It just wasn't something that I was kind of prepared for. I knew that I was interested in being a doctor and I thought that that is something that I would definitely do in the future, but I didn't want to jump right into it. I wanted to make sure that I kind of explored all the other things that I knew a career in medicine would not necessarily afford me the time to do later on. And so what I did was I kind of wandered around Europe immediately after I graduated. And then I got a job in Paris translating French for a sprinkler company. And I think the most important thing is that you can take time to decide. This is a huge commitment. And, to kind of sow your wild oats, so to speak, is really important because you want to make sure that you have come to a point where you are fully committed to being a doctor because it is a long road. And I know many people and have interacted with many people along multiple stages. So whether it's while we were in medical school or during training or now as an attending who sees residents, who really struggle with this, because if you go straight through and you haven't really had the opportunity to mull over what life outside of medicine would be, it can be a bit of a shock, and people aren't necessarily able to really fully comprehend what that means until you're in the midst of it. So make sure that if you do have any doubts, there's no path that says you have to go immediately straight through. So when I moved back to Chicago, I worked at the Chicago Medical School, which is now Rosalind Franklin, in a lab studying neurodegenerative disorders. And I think, taking time off can be really restorative and really help you focus. And you can really decide what it is that you're interested in. And it reaffirmed for me my decision that I wanted to do something related to medicine. I didn't know exactly when I started this job if maybe I might want to be just a PhD, a basic science researcher. But it's very lonely being in a lab all day long and just kind of dissecting rat brains and staring through a microscope. And I really missed the sort of interaction with people, especially having had a job and living abroad and meeting a bunch of different people. I missed that. And I knew that that was something that I needed, and that I felt like medical school would be the best way for me to kind of put that all together. And so then came my decision to actually apply to medical school. So I went to the University of Illinois at Chicago, which again, here is in Chicago. It's a good thing I moved away for a little bit to France, or else people would think I never actually left the city, but in fact I have. And Chicago is a huge hub for medical training. It's said that about 1 out of every 6 physicians in the United States passes through Chicago at some point of their training. So whether that's medical school, because we have many medical schools, whether you're even, we say 6 MD programs, but we also have DO programs. So there are tons of medical schools. We also have tons of residency programs and fellowships, and a bunch of academic medical centers where people come and work at afterwards as well. So a lot of people definitely come through Chicago. And so I was one of those 1 out of 6 who came to Chicago. And when we think about medical school and we think about what it is that we're going to do in the future, I really had no idea what that looked like for me. I had done that neuroscience research, so I was thinking that potentially something related to neurology. But then you get into medical school and you realize that there's this huge, vast arena of things that you've never even recognized or been aware of. And I think the most important thing about medical school is it is truly a privilege to be selected to be a physician. It's something that is a great honor, and we try and represent that through things such as white coat ceremonies when you start medical school. But you are given a privilege that very, very few people have, and it's a huge responsibility. And to be privileged enough to be able to take care of individuals in body and mind and all the different ways that we do that means that you are provided the opportunity to explore the entire body in a way that nobody else is. And so go into that experience totally open-minded, because you might go in thinking that you are going to be an OB/GYN and you might fall in love with psychiatry or whatever that is. And so it's really important that you take this incredible opportunity being offered to you to explore all of the things that medical school has to offer for you. So University of Illinois is somewhere over here, kind of on the west side of the city, probably more over here actually. And then I didn't travel far. I just came south to the University of Chicago here. So this is a little bit unique. The medical center and the medical school is on the physical campus of the University of Chicago. You can see this is the historic college campus here, and then this is the medical center right here. And that really imbues the atmosphere with a sense of really serious, rigorous academic inquiry and discovery and research that isn't always present in some medical schools just because there's not the ability to cross collaborate and kind of cross pollinate with the university that the medical school or the medical center is affiliated with. And I knew when I did this that I was really, really interested in having an academic career. So there are different ways that we think about what careers are going to look like. You can have just what's going to be a straight private practice sort of model. You can have an academic career where you're really focused on what we call a tripartite mission of research, education, as well as clinical care. Or you can be in a practice that's something of what we call a hybrid, so an academic community-based sort of practice. But I knew based on my prior interest and my prior research experience that I was really looking for a very rigorous sort of structured academic program. And so that's why I chose the University of Chicago for my training place. So I decided to do general surgery because I knew that I wanted to be a surgeon. There was no question about that. When I started medical school, like I said, I thought maybe I wanted to do neuroscience. About 2 days into our neuroscience class in first year of medical school, I decided there was no way I was going to do that. It just actually in practice was not interesting to me. So then in second year, I started through all these different rotations. And general surgery was the one thing that I could, or surgery in general was the one thing that I could really see myself doing. Because for me, what that represented was the most competent person in the hospital. At 2 a.m., when something's going wrong, it's usually a surgeon who can fix the problem. And the residents were such incredible role models for me. It's funny because if you have a great experience on whichever rotation that is, it might have been psychiatry for me, it might have been peds, it might have been family medicine. But the people who are there and are interested in you and serve as role models are the ones who really inspire you. If you have a great time and the team really meshes, you might decide that you're going to be a surgeon. If you don't have a great experience, if it's kind of a malignant environment, you might think there's no way I'm going to do this. These people are miserable. So it's really interesting how that kind of plays a huge factor in what people end up doing. And while I knew that I wanted to be a surgeon, I wanted to be the person who got everything done by 7:30 in the morning that the medicine residents spent the rest of the day doing and still had this incredible skill set and were so highly advanced and technical. I didn't know exactly within general surgery what most appealed to me yet. I thought that was a little bit too much of a commitment for me to make. There are very specialized training programs now that didn't even exist when I was doing medical school, where you can actually go straight through plastic surgery, or even now vascular surgery or cardiac surgery, that weren't necessarily options then, for which I'm grateful because I may not have been a vascular surgeon if that had been the case. But about I don't know, a year into my residency, I decided that research was something that was really important to me, reaffirmed that. And in many academic general surgery training programs, most of us take a couple of years during the middle of training to do a research fellowship. So I still wasn't exactly entirely convinced what it was that I wanted to do within general surgery. I thought maybe surgical oncology, but I had been exposed to vascular surgery, and I thought it was really interesting. I thought the people who were doing it were a little bit nutty, to be honest, because you do these crazy huge operations and you are in the operating room for like 10, 12 hours at a time, and then you finish and it doesn't work and you have to start over again. I thought, what are these people doing? But it was really, really interesting because It's the one specialty where you operate literally from head to toe. One day I might be doing a carotid endarterectomy, and then I'll do an endovascular aneurysm repair, and then I'll finish off by doing a fempop bypass in the leg. We are the only specialty really that operates in every single body cavity. There's so much creativity involved. You can present 10 vascular surgeons with the exact same patient scenario, and you will have 10 different solutions for that patient, and none of them are wrong. And that's what's so great about it. We have all of these sort of skills and techniques that we can apply to the patients and really do all these really amazing things in a very creative way. And it has to be perfect. When I sew an anastomosis at the end of the case, if that connection between the blood vessels is not perfect, then I'll know it because the patient will bleed. You have to be technically very skilled to be able to do this. We sew with suture that's finer than a human hair, and you have to be very precise in it. And at the end of the day, you know what your end result is. If at the end of the case, I finish and the patient has a palpable pulse in their foot, I know I did a good job. If at the end of my EVAR, I take the final completion angiogram, and there's no filling in the aneurysm sac, I know I did a good job. In colorectal surgery, if I take out a colon, I don't know how good of a job I did until the final pathology comes back. There's this ambiguity to many sorts of surgeries that isn't really present within vascular surgery. And so those are the things, especially that I considered during my research fellowship, that led me to do a clinical vascular surgery fellowship, lasted for another 2 years. So this is kind of sort of the things that I do. So we do, like I said, aneurysm repairs. We do these complex sort of aortic cases. We do lower extremity things. And this is really just kind of day to day for me. So there are about 3,000 board certified vascular surgeons in the United States. And we think about half of all medical students are women, maybe even a little bit more kind of post-COVID. 15% of general surgeons are women, which, is not a great statistic, but isn't terrible. But only about 8% of vascular surgeons are women. And although we're making progress in this realm, we still haven't completely solved sort of the disparities gap that exist within the training paradigms. So what is it that a vascular surgeon actually is? So we're specialists who are highly trained to treat all diseases of the vascular system. So whether you have an aneurysm, like this is a patient who had a huge aneurysm of a AV fistula in their arm, or whether it's somebody who presents with a thrombosed leg, and this was in case I did a couple weeks ago where I did a thrombectomy, and this is the blood clot I pulled out of the leg, or if it's abdominal aneurysm disease, if it's lower extremity disease, we are the only specialists who are trained to treat all of these things. But we do much more than just surgery. Vascular surgery is one of those conditions that I will never cure my patient of. It's not like a cancer. I help my patients live their lives. We manage, we prioritize, we develop goals together, but it's not just a curative sort of thing. And I am one of the few surgeons who actually tries to find reasons not to operate on patients. We try and save surgery for the very last kind of court of last resort for these patients, because once I do a bypass in a patient, that bypass will have a limited lifespan. And I want to make sure I'm maximizing the amount of time and the amount of sort of life that the patient gets out of that. This is a picture that was taken a couple of years ago of me and a couple of my colleagues who started a limb salvage program. And we, treat patients for wounds and infections and things like that. So we're really kind of all encompassing. And I think that's something that most surgeons don't really do. As I said, we perform every kind of vascular procedure. This is a picture of one of my fellows and me doing this very complex aneurysm repair. And we had visiting surgeons from Japan shadowing us a couple years back. But we're the only specialists who are trained to do everything, endovascular, open. So we have the full toolbox and we can really apply what the absolute best solution for each individual patient is. And I build relationships with my patients. As I said, I will never cure them of their vascular disease. We help manage it. And so I have patients that I've taken care of for 10, 12 years. And it really becomes something where you have to have relationships and you have to have rapport to make this sort of thing work. So my life is like a tornado at all times. It's crazy. I'll wake up, I go to the hospital, I have meetings, I see the patients, I round, I talk to patients in between and talk to families. And then in the midst of me doing all of my cases, I still have to dictate the op notes, I have to sign them, I have to read the vascular labs from the day. I'm doing research, I'm in charge of the fellowship, so I have fellowship related responsibilities. I spend time with the undergrads who are shadowing and teaching the medical students and all those sorts of things. So I really do wear many, many different hats. So as an academic vascular surgeon, not only do I operate on patients, but I have all of these other sort of responsibilities. And like I said, it's a tripartite mission. So it's clinical care, but it's also education. So I educate medical students, residents, and fellows. I lead multiple clinical trials and research projects within the section. I am on a lot of quality initiatives, and I do work for the American College of Surgeons, the Society for Vascular Surgery. I'm on the admissions committee for the medical school, and then I'm on the editorial board for the Journal of Vascular Surgery as well. So I say this because I think it's really important that sometimes medical students or residents or fellows think it'll just get better once I'm done with training, then I'll have more time. And my argument is the older you get and the more you do, the more responsibilities you tend to take on. And so it's cumulative, it's additive. It's not that medical school is the penultimate sort of thing and then things are going to get better. It doesn't necessarily work like that. So it takes a really long time to get to this point. For me, it was 9 years of training after medical school. But it's really important that you maintain your humanity throughout all of this. So I'm the mother to 3 boys. I had 3 children during my residency, believe it or not. People ask me how I did it, and I say I just kind of went into a fugue state and I just got through it. But your life doesn't have to cease, and you continue to live your life throughout the entire, point of your training. There's nothing that says that you can't do these things. It's not easy, but it's absolutely something that can be done, because women ask me this all the time. Well, I don't think I can be a surgeon. I don't think I can be a vascular surgeon because I want to have a family. And you can absolutely do all those things. You just have to manage your expectations. This year, have traveled to all of these different places for work. I do a lot of traveling for work. I go all around the country and the world speaking and educating about vascular surgery. And some of these also are trips for fun. But it's like a really important part of what I do as well, is to ensure that I still am able to do the things that I enjoy. This journey kind of started with me moving to France, and I still really find travel to be really important and restorative. I'm a huge reader. These are the books that I read over the course of 1 year, 2 years ago. So I read like 109 books or something like that. So this is one of my outlets that I have. So if there's something that you really love doing, you can still do it. And another thing that's really important to us is art too. And so I again, what I do is very visual and very sort of artistic and creative. And so being involved in the city's art scene is something that's been incredibly important to me and my husband. And it's something, this was an article that was just recently published about us and our collection and our philosophy towards how we use art to better our community. And it's something, that is really important to me. And it really shows the multifacetedness of individuals. And it helps me be a better doctor and a better surgeon. So at the end, your metrics count. Your consistent academic performance is important. There are small hiccups that are forgiven, but it's really substance that we care about. Again, I'm on the admissions committee at Pritzker, so I go through this every single time I review an application. I want to make sure that you have interests, that there are things that you've explored, that you have a range of experience, because now is really the time to develop your passion. My traveling, my reading, my love of art, it wasn't something that came once I finished training. It's something that I've developed all along and really nurtured. Leadership is important. You will have to do this the rest of your life, so you better start now. Be a leader in whatever it is that you really care about. And really make sure you're giving a careful consideration of career choices. Make sure you shadow and volunteer and explore other options, because you want to make sure that this is absolutely right for you. And then prioritize service to others. Selfish devotion to others' needs starts now. Make sure that this is something that really matters to you. So thank you very much for that. For anybody who has any desire to get in contact with me, this is my email information, and I'll stop sharing, and I'm happy to ask any questions.
Thank you. That was amazing. I'm always in awe of everything you do. And so are all the attendees. We have so many questions. So any other questions you guys have, feel free to keep adding them to the Q&A chat. The first question I have is, this one is the most upvoted one. So how do you keep yourself motivated through the years of training, and how do you mitigate burnout?
I'm not going to say that I have a great answer to that. Burnout happens. And I think the way that we mitigate it is by recognizing it early. I was reading this really interesting article the other day about how doctors don't take vacations. And, we look at people who take vacations and they have less rates of burnout. The people who wrote the article said, we never take a vacation. We actually work during our vacations. So I think as your generation becomes physicians, it really has helped to have people who are much more aware of all of this kind of push all of us to be better individuals. There's a lot that goes into being a doctor, and we don't talk about work-life balance anymore. We talk about work-life integration, and I think that's great. And I think we want to be more balanced in all things, but it still really is a calling. It's a vocation, and it's something that you have to be willing to make some sacrifices for. Training is long, and it is hard to kind of necessarily motivate yourself throughout the entirety of it. I guess, the way that I did it was I broke it up into smaller chunks. Like I did 3 years of residency. The first year, you're just trying to figure out what the heck it is that you're doing there. And then second year, you start to kind of finally get a little bit of swagger to you, because you kind of finally decide things. And then third year is where you're actually starting to do things in the operating room. And that's what you've been here for all these years. And then I took my time and I did my research. And that was nice, because that was really restorative, because you could actually stop and think about surgery, and you could think about all of the things that we were supposed to be learning. And then you come back and it's only 2 years. And again, I think because there is graded responsibility and you get to do higher level things constantly, there's always something that you're looking forward to and pushing forward to and achieving. And I think that's probably how most of us get through surgery residency, because it's just this huge slope and this steep curve that you're taking constantly. And so I think that's really what is probably motivating to the sort of personality that goes into surgery.
Thank you for that. Next question is, what interests or qualities from applicants stand out to you? I know you touched upon that in your presentation, but do you have something that is a puncher in an application?
I think people who are really committed to something, it doesn't matter what it is, but if you show that you've really gone deep into something, I think that's the most important thing. We know that there are people out there who do like resume padding, right? You do a bunch of different things because you think that we want to see that you've done 50 different activities. It's not so much that. I want to see that you've really committed yourself to something and really dug in deep to something. There was an applicant last year that I really remember, and she had spent like 1,200 hours volunteering at a jail doing, that kind of work. And she was passionate about, the sort of incarcerated population and doing things like that for that particular population. And I just want to see passion from you. It could be passion in anything. If you are, world-class concert pianist, that's great, because it shows me that you have dedication, that you have drive, that you can set goals for yourself, you can achieve those goals. It doesn't have to be remotely related to medicine. I want to make sure you've done some shadowing or some volunteering or something, because I want to make sure you know what it is to be in a hospital and that you have some sort of connection to patients or people. But I just want to make sure that you have real dedication and passion to something in your life.
That's amazing. Thank you. The next question I have is, if someone wanted to take a gap year to enjoy and explore their hobbies while still volunteering, but instead of doing strictly research or getting a clinical job and exploring their hobbies while still volunteering, do you think that negatively impacts their application?
No, I don't think so at all. Again, it's going to be a long road. So I think as long as you're doing something along the way to kind of show the admissions committee that you're still committed and that you're still interested in being a doctor and that you're doing something to prepare yourself for that, if you're volunteering or shadowing or doing something along that way, I think that's great. But really, at least I can't speak for every medical school. I can speak for Pritzker School of Medicine at University of Chicago. We really are interested in interesting people because, again, so much of medicine isn't just, memorizing the Krebs cycle or, being able to recite a bunch of physics formulas or equations. What it really is about is your ability to connect with people and be committed to patient and patient care. We serve the south side of Chicago, where we serve a very economically disadvantaged patient population. So, for example, I talked about the Limb Salvage Center, and the reason why I started that is because the amputation rate on the south side of Chicago is 20 times the national average, because of a whole host of factors. A lot of it is access to care, a lot of it is genetics, a lot of it is poor health literacy. And so we really are trying to make a concerted effort to go in and connect with patients and connect with people so that we can break down some of those barriers. And that's the thing that I think, taking time off allows you to do. It allows you to learn how to communicate with others, and really focuses you on what it is that you want to do. So I am a big fan of gap years. I think everybody should take a gap year.
Thank you. This one is a kind of specific question, but I thought it was very unique. I'm interested in surgery, but I've always been a lower energy person and have been told by many that it is not a feasible career for me. Do you have any thoughts on personality/energy levels on choosing a specialty or field?
So I don't think you have to be necessarily high energy to be a surgeon. I guess, there's some people who are very like high energy sort of, people where you look at them and you're like, oh my gosh, they're just radiating off this sort of energy. And then there are people who are very much more even keel. That your energy level, I don't know that necessarily is the mark of a surgeon. I think your ability to work hard and to be sort of dedicated is more important than kind of the energy level that you're portraying to others. I you can't be somebody who wants to sleep 12 hours a day and be a surgeon. Probably that's not going to work. But I think that as long as I think you also have to get your energy from the things that you're doing. So if you do a rotation and you find surgery is something that really feeds you, then I think that probably that will give you the kind of internal energy you need. If you do surgery and you're miserable, then probably not. But I think you have to, while you're doing it, envision yourself doing it for the next 30 years. And if you can see yourself doing it for 30 years, then that's probably the right thing to do. Some people say, oh, if you can envision yourself doing anything other than surgery, you absolutely should. And I don't think that's true at all. I can see myself doing all kinds of different things, but I absolutely love being a surgeon. I absolutely love being a vascular surgeon. And I can imagine myself doing other things, but I can't imagine myself being as fulfilled as I am every single day with this job.
That's amazing. Thank you. The next one is for those of us changing careers and pursuing medical school above 35, what is the best way to improve our dexterity if we're interested in surgery?
That's a great question. To improve your dexterity, I guess just any sort of kind of manual sort of thing. I don't know, maybe take up knitting, do something like that, where you use your hands. So much of general surgery is now laparoscopic or robotic. So people who tend to actually enjoy that are people who played video games a lot. So for anybody whose parents have ever yelled at them to stop playing those video games, it's a waste of time. If you want to be a surgeon, specific kinds of surgeons, it actually probably isn't a waste of time. It's actually probably a good thing.
So funny. Next one is, I wanted to know more about the sacrifices you've had to make in this profession compared to the things you were able to have as long as you prioritize them. What do you think is missing from the life of a physician? This is a very deep question.
That is a very deep question. So I sacrifice every single day, all the time, right? I make commitments to my friends and family that sometimes I just have to bail out on. And I feel bad about that. But I have a really supportive network that really understands and is supportive of me and is supportive of the work that I'm trying to accomplish. So there I have missed, kids' birthdays before, I've missed holidays. I think those are the biggest sacrifices, right? Time with the people that you love. But I'll give you a little anecdote. So my husband is in finance. And as you saw, I have 3 boys. And one day at dinner, the one thing I always try and do is we always sit down every night as a family and eat dinner together. I think that's really, really important. And that's, kind of how we mitigate that. I always say quality over quantity for us is what I try and do. But one night we're at dinner and my husband, was saying, Trissa, you're just working too much. You have to slow down. You have to stop. And my eldest, who at the time was probably 8, said, you know what, Dad? Mom saves people's lives every day. You read the Wall Street Journal. Just leave her alone and let her do her good work. And so I think, having the example that I've set and my children having grown up in that environment from the start, and me still trying to spend the time I can with them and for them to know how much I love them really has offset that as much. But there are things that I absolutely have missed out on. However, if I wasn't doing this job, I don't think I would be as good of a parent for them or as good of a wife or as good of a friend, because I wouldn't be as intrinsically fulfilled and happy, I think. And there is a point where you do have to kind of take a step back and think, maybe I am doing too much. Maybe I need to not accept this sort of thing. Somebody just asked me to be an editor for this particular journal. And I said, I can't do that right now because I knew that I just couldn't take the time and devote the time to it. So I guess that's a sacrifice as well, right? Learning how to say no and realizing that you can't do everything and that you do have to prioritize some things. It's not easy, but for everybody, it's different, and everybody has to decide what it is that they're willing to give up and what they aren't.
Your kids sound great.
They are. I'm very lucky.
I have a couple questions regarding first generation low income students, so I am going to combine them into
Sure.
one. For most of them, we have to work our way through college. So, what are ways to show how that we have other interests outside of work when it feels unmanageable? And how are some ways to reach resources that we aren't given access to because of our connections?
Yeah, so we take this very, very seriously at Pritzker at the medical school because we understand and we have different expectations for under-resourced medical students or medical student applicants than we do from people who have not had those sort of challenges. So I think the best opportunity you have to address that and kind of speak to that is in your personal statement. Your personal statement is so incredibly important because it actually gives us the opportunity to learn more about you as a person and some of the challenges and struggles you've been through. So I don't think that at least we don't. Again, I can't speak to other medical schools. We certainly don't expect the same thing out of every single applicant because we know not everybody has the same resources at their disposal. As far as resources, I mean, there are a lot of schools who don't have healthy sort of pre-medical kind of resources at their institutions. However, there are a lot of national programs that if anybody specifically has any questions, feel free to reach out to me later and I can give you some resources for people who are under-resourced or low income or first generation that specifically look for assisting you in this process. And so, just going down those pathways and looking for assistance, even outside or resources or mentoring outside of your home institutions is really important as well.
Thank you. The next question is, how has it been being a woman in the world of surgery, especially having so many amazing leadership positions?
Um, it's been great. And the reason why is because I am at an institution that actually has always made women feel welcome. It's not always the case everywhere, and I understand that. But my own personal experience has been really comfortable with that. I go to conferences and I'll be one of, like, I don't know, maybe I just gave a talk in London and there were probably 200 speakers overall at this conference. And I was one of 5 women who were asked to speak at this conference. And so I think sometimes when I get out in the real world and I look at it through that lens, I realize that I am incredibly fortunate because I live somewhat in a bubble. But it never occurred to me for whatever reason that I couldn't do this. It never occurred to me that though this is something that women don't do. I just knew that I would be really good at it and it was something I really wanted to do. And so I kind of just ignored all of the chatter around it. And still there, we as medicine or people in medicine are probably 20 years behind our colleagues in the business world as far as thinking about this and integrating in the same way. We're getting better for sure, but I think it's important that we have women who are in these positions and talk about this like this, because it's hard for people to envision themselves being something where they don't see themselves reflected. And so by being one of the early women vascular surgeons and having these positions, it gives me a platform where I'm able to empower others. And for that, I'm really grateful.
I'm glad to hear that. The next question is a little more niche, but what are book recommendations you have for a beginner bookworm?
A beginner bookworm. Oh my gosh. So many great recommendations. Let me see. Let me just look at my bookshelf that I'm sitting right next to right now. I would say, oh my gosh, there are so many. I don't even know where to start. The book that I last read that I really loved was called The Biography of X. Check that one out.
And everyone else, please feel free to share your book recommendations in the chat. The next question is, I've always heard of cardiovascular surgery as a specialty. Would this fall under vascular as a fellowship, or would it be something more separate as its own field?
So we have vascular surgery and we have cardiothoracic surgery. People put cardiovascular together because that's kind of how we learn about it in the medical school curriculum, kind of as like a body system, but it's actually cardiothoracic surgery or vascular surgery. When you do a cardiac fellowship, you have to not only learn how to operate on the heart, but everything in the thoracic cavity. So you'll also do like lung, esophagus, those sorts of things. So they're entirely separate.
Very interesting. Thank you. And thank you for everyone contributing to their book stories. we have time for one more question, and it will be, let's see. How do you make time for patient interaction while having all the other responsibilities? Do you ever feel like you're not giving enough time for it all?
No, I really prioritize the patients above everything else. So I take forever in clinic to sit down and talk to people because I think what I'm trying to explain to them, especially because a lot of my patients have not the sort of medical sophistication that a lot of people do. I think it's incredibly important that I'm very intentional, deliberate, and that I take time to interact with them and not sit on the computer and chart the entire time. So my patient visits take, in general, quite a while. Now, if it's somebody that I've seen for 10 years and they're coming in and their studies are stable, I'll just say, so good to see you. Everything looks great. We'll see you again in, X amount of time. Those interactions are relatively short. But for patients who have really complex problems, I take a really long time with each patient. And everybody understands that and knows that when they come for their 1:30 appointment, they may not be seen until 2:30. And then I'll be really, really sorry, but I will convince them that it was worth the wait once they actually see me. And then I always take a lot of time when I round too on the patients. It might take me an hour, sometimes 2 hours during the day to round, depending on, how many patients we have and how complicated everybody is. But the reason why we're doing this is to take care of people. We're not here to take care of problems. We're here to take care of people. And so part of that is not just addressing whatever their vascular problem is, it's listening to them and listening to the other problems that they have. And the reason why they might have come in with their bypass occluded was because they can't afford their medication, because they've lost their Social Security benefits or whatever. But I would never know that if I didn't take the time to actually speak with them about these things. And not that I can help them with their Social Security benefits, but then I can get them in touch with a case manager who can. So never discount that this is a person, this isn't a problem that you're helping.
Thank you so much for joining us, Dr. Babrowski. What an amazing presentation. I know myself, I'm interested in a career in vascular surgery, so I learned a lot. Thank you everyone for joining. Please give a round of applause for such a great presentation. Again, this will be recorded and posted on our YouTube channel at National Prehealth Conference. Thanks again for joining us. If you have any further questions, I did plug her email in the chat, and you can email us as well. We can relay any questions. Up next is an academic career in otolaryngology or head and neck surgery, ENT surgery. There's many names to that. If you'd like to learn more about another surgical specialty, up next with Dr. Philip Chen. So make your way over there. We'll start promptly at 11:30 Pacific time. Thanks again, and have a great rest of your Sunday.
Thank you.